Thanks for staying with us here on The Real Story. The legislature might not be in session, but there's still serious changes coming for Connecticut, between rate hike proposals and health insurance to penalizing the state's energy companies. Here to talk about all of it and more is our Attorney General, William Tong. Thank you so much for joining us.
Thank you, Emma. Thanks for having me.
So a really busy summer for your office, a lot going on, especially this past week. Let's start with health insurance. You've set yourself up as a real warrior for affordable, accessible health care for people here in Connecticut. Health insurance companies are asking for approval to raise those rates more than 12% on individual plans, nearly 15% on small group plans. But you and some state lawmakers as well have said this is unacceptable. Tell me a little bit about that.
These are really punishing increases. I mean, most people haven't seen their wages go up 10, 20, 30%. Right. And these big, huge companies are coming in to ask for ever more money. And the question I'm asking, so many people are asking, is why? Why do you need millions of dollars more? And I don't know if I'm a warrior, but somebody has to fight for Connecticut families and individuals. And we just can't afford these increases year after year after year. And you were there at this hearing. And what really shocked me is I asked them, my team asked them, do you sit down with the big hospital providers and go through line by line, cost by cost, every service, and try to negotiate those prices down? And they said, no, we don't do that. I mean, I was flabbergasted. And it's time somebody stood up to them and held them accountable.
And as you said, we were both there at that hearing this past week where you were really trying to answer that question of why with insurers. There were some interesting things brought up during that hearing. One I wanted to talk about was step therapy. People and even healthcare professionals have expressed a lot of frustration with this step therapy when people are required to try a less expensive version of their prescription, a non-brand drug, to hopefully save health insurers money. Anthem said they'd be willing to ban this, but only for 2 to 3 years. I'm curious where you stand on this.
We heard a lot of industry terms and mumbo jumbo during this hearing, and at the end of the day, that sounds to me like cost cutting, right, and saving money. At the end of the day, you know, I make this point over and over again with health insurance. This is not a nice to have. This is not some optional thing. It's not like, do I want a nicer car or a less nice car, right? This is something that people need to live. And many people need complicated, long-term treatment and therapy that I'm not qualified to assess as a lawyer or patient, obviously, as a lay person. And most people can only trust one person, and that's their doctor. And we should leave it to the doctors and not the bean counters and bureaucrats and people that are just there to shave off every dollar so that profits and revenues are as high as they can possibly be.
And we'll see an answer from, you know, the insurance department on these rate hikes next month. I will be waiting to see that answer. I'm sure you will as well. Another big conversation about rate hikes this past week when it comes to energy prices. United Illuminating, you know, once again asking for rate hikes for people who don't know what's going on. You know, they may just see their expensive energy bill coming in the mail. Can you give us an overview of what's been happening with that and where we stand right now?
Again, United Illuminating, which is a good company, and let me just say that the people, the men and women that work at UI, they do a good job for the people of the state. You know, and they take risk for our families. These are dangerous jobs, and they do a good job, a great job keeping the lights on and the power coming to our homes. But at the end of the day, at the corporate level, UI came in and said we need $131 million more dollars, and we said why? Why do you need $131 million more dollars? And they didn't prove it. They didn't show to PURA, the Public Utility Regulatory Authority, and the state of Connecticut why they need millions upon millions of dollars more when we're already paying way too much for electricity, when they didn't do a great job during Tropical Storm Isaias, when their customer service has some real issues, when they failed to clean up English Station in New Haven, which they are legally required to do. So given those issues, despite the fact that they're a good company, PURA took all of that into account and said, no, we're not going to give you $131 million more dollars, and I think that was the right decision.
And so you mentioned PURA here. UI has, kind of lobbied against them, but lawmakers have applauded PURA, and I know even some conversations when it came to health insurance, should we have a similar regulatory board or authority for that industry, wanting to give it more power. We saw a conversation about possibly performance-based regulations. Can Connecticut count on PURA when it comes to the complex energy costs and crisis we're seeing?
I think we're seeing that this PURA, with these commissioners and this chair, is taking their responsibility very seriously. And not only do we have performance-based rate making, which means we're going to give them a rate of return. We're going to let them make money based on their performance. Right. And when they perform well, they'll do well as a company. When they don't perform well, we're going to hold them accountable. And this is what performance-based rate making looks like. It's a fancy term. It means do your job and do it well.
Right.
And if you don't, we're going to hold you accountable.
Sure. So your office, as we said, certainly has had a lot going on right now, but we just saw this past week a state audit report coming out about some possible poor accounting, saying the state may have lost $10 million between 2020 and 2021 between staff compensation, state lawsuits, settlements. Can you explain a little bit about what this state audit report is?
There's no poor accounting. The Office of the Attorney General, as the state's lawyer, brings in more money than any other state agency other than the Department of Revenue Services. As you know, since I became Attorney General, I've been part of a group of AGs that's recovered over $50 billion from the opioid and addiction industry, more than $600 million for Connecticut alone. So there's a lot of, frankly, settlement money, judgments, a lot of money going in and out through all the cases that we manage. And this is about, frankly, cases in which we are trying to collect money from other people. And sometimes that's a struggle, and sometimes that's hard to do. And so we accept feedback and input and criticism. We're not afraid of it. And if we can do something better, we will. But this is a criticism about the collection of money from other people, and we will try to do a better job.
And I do want to talk about that opioid settlement.
Sure.
But first, the audit did call out your office for using, paper timesheets. The office has said they're moving towards a more computerized system, but, feel staffing shortages have hindered you. Can you tell me just quickly about those staffing shortages?
It's true about every state agency.
Sure.
And particularly as we come out of COVID, the move to technology-based solutions, computer-based solutions, it's happening everywhere. I think, to be honest, it's slower in government, and it's tougher to adopt these new processes, and we're trying to get there. We're not there yet, but we're working on it.
You mentioned the opioid settlement. People have been talking a lot about that and about that money. You said $600 million. That's a lot. So, where do you think that money needs to go?
It needs to go and will go to treatment, prevention, and addiction science. So one of the criticisms of the tobacco settlement, which is the largest ever cash multi-state settlement in history, thank you, Attorney General Blumenthal, when he was Attorney General. One of the criticisms was that money did not go to smoking cessation, to fighting smoking as a public health emergency. That's not entirely fair, because that settlement contemplated that we could use that money to pay for expenses we already incurred. But to answer that criticism, to the extent that it's valid, we said in opioids, we want most of this money to go to forward-looking work. And it's work we call abatement, and meaning abating the crisis. And abatement is loosely defined, broadly defined as treatment, prevention, and addiction science. And so the way we've structured it is, this money is going to programs, to nonprofits, to cities and towns, to healthcare providers, to law enforcement, the boots on the ground who are fighting what is the worst public health crisis in America.
Well, I wish we had more time. It's always a pleasure to speak with you, but I'm sure we'll be seeing you around. We have a lot more to see when it comes to these rate hikes, and I'm sure we'll be talking to you again soon.
Thank you, Emma.
Thank you, of course, for being here. That does it for us on The Real Story. But if you want to watch these segments again, you can head to fox61.com or download the Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61 or streaming on Fox 61 Plus. Have a great morning.